Okay, thank you for that report, Christina. York Region has confirmed 11 COVID-19 cases have been linked to a birthday party in Vaughan. York Region tweeted they have issued a public notice for a birthday party at a private residence on December 6. 22 people attended the private home. Now 11 cases have been linked to this event. High-risk attendees have been advised to isolate and monitor for symptoms. The ages of those infected range from 3 to 54 years old. And for more on this, we're joined live now by Vaughan Mayor Maurizio Bevilacqua. Mayor, good morning. Thank you for speaking with us.
Good morning, Jennifer.
I want to talk about this birthday party first. This is something that we've seen again and again, just people getting together in the privacy of their homes because they can get away with it and breaking the rules. What do you think is going to stop this? Do you think that enforcement officers need to be knocking on people's doors just to make sure this doesn't happen? Because obviously the message is not getting across and the fines are not deterring people.
Okay, so I want to talk about this as well, Jennifer, because I think there are lessons here. There are lessons that everybody ought to learn from. And that is that having a birthday party with 22 people present and 11 COVID-19 cases connected to it is not responsible. These are not ordinary times. We can't be celebrating birthdays and every other occasion like we used to. It's appeal to the common sense, to the logic, to the intelligence of people. We're at war against COVID-19, and we can't afford defectors. We simply can't. The price is too high. You look at this particular case where 7 are a high-risk category. That means they're endangering their own lives and the lives of others. And this education that we're on, it's got to be continuous. We have to repeat the story over and over again because it's not penetrating through to everybody. And I do think that at the end of the day, when all is said and done, it comes down to personal responsibility. It comes down to that sense of responsibility that says to yourself that you cannot endanger other people's lives and your own. It's quite disheartening to hear about these stories because we have worked so hard to make sure that the message gets out, that we talk about the fact that you can't have these kind of gatherings, and we repeat it on a daily basis. Yet you hear this story, but let's look at this in a very positive way. Now we're talking about the story. We're relating to the viewers that, you have 7 high risk who are now self-isolating and self-monitoring. We're just about to enter that period of Christmas festivities. We're presently celebrating Hanukkah and other festivities. What does that tell you? I guess the lesson and the purpose of this story is to instruct others not to repeat the same mistake. And that is what I take out of it. $880 fine, that's great. We're enforcing. Enforcement is working. It did, on a number, for a number of months, we've issued close to 200 tickets and violations. But the health of the people here is at stake, and we cannot live in a society where people are acting irresponsibly when people are dying.
Right. Mayor, York Region managed to escape being put into a lockdown on 2 previous occasions. Do you think that was a mistake? There have been calls that York Region should have been put into a lockdown much sooner. What do you think?
I don't think so. I think that our modeling and our medical officer has been correct throughout the pandemic. We have an excellent team that analyzes data. And I think it wasn't a mistake at all. We based our decision on science and the advice of medical officers. I'm certainly not in the business of second guessing because decisions are made and we take our time. We analyze the issues very carefully. And we know that we're dealing with COVID-19. It was a serious virus that is, people have died. It's brought the economy to its knees. And we always try to balance our decision. And I think we've done a very good job at that. And I think that the medical officer, Dr. Kurji, has been on top of his game on this particular issue because he understands all sides of COVID-19. And I feel very comfortable with his guidance.
Mayor, one last question. Everyone is awaiting the Premier's decision today about what regions could be put into further restrictions. We have heard that the Ontario Hospital Association, they're calling for the Premier to put regions with 40 cases of COVID-19 per 100,000 people into a lockdown. And the Registered Nurses Association of Ontario, they want a 2-week provincial-wide lockdown. What do you want?
I want the best decision that takes into consideration all sorts of issues that we've dealt with throughout the global pandemic. I mean, I represent a city that was monitoring COVID-19 6 weeks prior to WHO declaring it a global pandemic. So we are well equipped to make the decisions that I think are correct ones. I think that various bodies like nurses and the Ontario Hospital Association, I do think that the real question here, as people claim that that our healthcare system is at a brink, we have to ask ourselves, why is that? Is it resources? Is it human resources that are lacking? Because, quite frankly, hospitals exist to also address crises in a society. We rely on our healthcare system to get us through things like COVID-19. That's why they exist. And so the question that we ought to ask ourselves is, why are they on the brink?
Mayor Bevilacqua, I'm sorry, we're running out of time, but we really appreciate speaking with you today, and I hope you have a safe and happy holiday.
You too, Jennifer. Be safe.